oils in oral health class. So, anyways, as I was saying, some of you are jumping on. We're going to do a hands on activity if you want to participate. And if not, you can just watch and learn. But you will need your bottle of myrrh and some floss. That's all I'm going to say. So, if you have it near you, just go and grab your bottle of myrrh and some floss. And if you don't have floss, the next time you see your hygienist, ask her for some floss. Or Costco, I think, has it on sale right now, that pack of Glide. Okay, I'm going to get to it. I'm going to share my screen. All righty, here we are. Slideshow. All right, so welcome to our daily essentials to support your oral health. So this is obviously related to doTERRA, but I'm also going to take you through some little techniques and tricks and ideas that I've learned kind of along the way and I've shared with my patients daily. And I just worked at that office yesterday that really is strong in natural healthcare or natural oral care, I should say. So I've been sharing a lot of my tips and tricks with my patients, which is so exciting for me. I love that when a dentist supports my ideas and they just kind of let me run with it. So unmute or use the chat, whatever you want. But yeah, I'm just going to get started. So the mouth is the beginning of our digestive system. So when we intake food, water, soda, juice, whatever it is, it all starts with the mouth. So our mouth is a bacterial party. It's full of bacteria. The mouth is very, very dirty, actually, despite how amazing your home care is. Despite you flossing daily, brushing daily, you're actually just keeping your bacterial levels very low. You're maintaining your mouth, but you can never, ever have zero bacteria or zero plaque. When we eat or drink, besides water, our mouth dips down into an acidic state. And that's when bacteria has a party. They literally have a party in our mouth because that's when they're able to thrive and multiply. And we have bacteria that are aerobic and anaerobic. So the aerobic bacteria, which is above the gum, they are easier to maintain. It's easier to kind of calm those guys down. The anaerobic bacteria that lives below the gum, they can get a little fussy. They want to continue to thrive and multiply. And so that's why good home care is necessary. So our flossing, our brushing, whatever else that you might be doing, water picking, water flossing, but adding in certain oils can also help to decrease bacterial levels and maintain a healthy mouth. So let's start outside the mouth. We're talking about our lips because when we eat and drink, this is the first place it touches. It touches our lips. So we obviously want to take care of our lips, cracked lips, cold sores, things like that. Gets very irritated. It's very exposed to air, wind, just all the elements, right? Our lips are very, very exposed. So, if you're at the beach all day, more than likely your lips are going to get sunburned and it's very, very uncomfortable. So, Kate talked about our sunline, which is amazing, and including the lips, right? We want to put some sunscreen on our lips. What happens when we forget or we get chapped lips or just those little cuts right here at the corners of our mouth? How can we support ourselves? So CorrectX is amazing. We've talked a lot about this. We talked a lot about it when we travel. So this is great even before we get to the point of chapped lips or the dryness kind of starts to set in. I like to do it daily. For me, just being in a mask all day, I like to have Correct X literally in my scrub pocket or nearby, in one of my drawers, and I'll just apply Correct X. I don't really like Vaseline. I know patients will ask because we're always tugging at the cheek, when we're retracting, when we're working, and patients will ask, or my boss will just do it, we'll just apply Vaseline immediately. So it's just more comfortable. And that's fine. But the benefits of CorrectX, right? We have lavender in there, we have tea tree, we have frankincense, I believe we have helichrysum. I thought I had a slide with all the oils listed, but it's so much better than just plain Vaseline because we get that additional support from those amazing oils. So perfect, as I was saying, if you have cold sores, um, chap, anything going on with the lips, CorrectX is awesome. All right, I threw this in here because we are in the mix of BOGOs, and I thought this is so perfect. Frankincense, so many healing properties. I mean, I feel like we've talked about this oil again and again and again. The beautiful thing about this, and wonderful thing of that we're having it as a BOGO right now, is that it's already mixed with fractionated coconut oil. So we know coconut oil alone is so soothing. So when you're mixing it with the king of oils, it's great support for those cankered sores, cold sores, um, extractions. I say that because my oldest just had his third molars, his wisdom teeth taken out. And he did a lot of frankincense support along the jawline and constantly with the roller, just rolling it in real gentle because he was very swollen on one side because of how that tooth was impacted. Um, Teething baby, we used a lot of this with Cody Boy. It's how we got through teething. It's so great for for you to just kind of rub it on the gums as well. But that inflammatory process is why frankincense is so great for anything mouth, and it's very very gentle, where it's not going to have that burning effect that we sometimes see with other oils. All right. Now we're getting into like our teeth and how we can care for that. So everyone is very familiar, I know, with On Guard and Supermint toothpaste. Supermint is the newest paste to the family, and a lot of people love using it in the morning because of that minty kind of wakes your mouth up, so fresh. That's why I love it. But I'm still in love with On Guard as well. So great to use at night. And we'll get into and how wonderful it is to pair with the On Guard mouth rinse. Um, but what makes this very unique is it does not have fluoride. And some dental care providers will frown upon that because we've seen great things with fluoride. I'm not going to lie. In small amounts used correctly. So, the thing about On Guard toothpaste and Supermint is we don't see any fluoride. But how does it help protect the teeth? So, they've included something called hydroxyapatite. And that is what helps to support the tooth structure. It very little cavities that might be starting, it can actually reverse that process or stop that process immediately. Um, there's no sodium lauryl sulfate. So that's the foaming agent that we'll see in like Crest and Colgate. And more people are becoming allergic to that. So when I say allergic, it's not like a true allergy where they can't breathe or going through anaphylactic shock or anything like that. The allergy that we see is sometimes they don't even know it's an allergy or an adverse effect on their teeth or their gums. And I'll just say, oh, have you noticed that you're starting to have like a film forming on the inside of your cheeks, your lower lip, kind of like a film on your tongue? And they're like, yeah, I did notice that. I'm like, what have you been doing different? Oh, I switched to, one patient just told me this. She's like, oh, I switched to Crest, baking soda and whitening with Scope. And I was like, wow. And she's like, why is there a problem? That sounded great. And it does sound great, right? There's a lot of marketing that's involved with certain toothpaste, or well, actually all the toothpaste. But when they start adding all the things like whitening and baking soda and scope and all these things they start adding in, it's too much oftentimes for our mouth. And the reaction is the sloughing of tissues. So that film, that's the sloughing where you're like, oh, this is really gross. Why do I have this film? And it's just your mouth reacting. It's too strong. It's too much. Um, you can't, that's not an everyday toothpaste that you should be using. And some patients are fine. I've had patients that tell me I can't use any other toothpaste unless it has baking soda in it. Okay, that's fine if that works for you. But more and more, I've been seeing that patients cannot handle that foaming agent, the sodium lauryl sulfate. So that's just something to keep in mind. What else is in here that makes it sweet? Xylitol. So xylitol is really great. It's natural. It's not like added sugar or anything like that. It helps to create more saliva, which we want. We want that washing away or washing away effect in our mouth, because when you have dry mouth, everything gets really sticky. And when things are sticky, um, bacteria wants to thrive and again have that party. So the more saliva, the better. We're actually washing things away. So that's what I will say. If you can't brush and floss after you eat lunch or whatever, at least rinse out really, really well with water. Okay. Let's see. Do we have anything? Okay. Just reading the chat real quick. Would you just use your finger to rub on baby's gums? Yes, I would. I have another slide for that, but yes, John, with Cody Boy, I actually will get into Copaiba a little bit, but I would put Copaiba and Frank on my fingers and I would just rub it on his gums and then he would like gnaw on it, like gnaw on my finger. And it's so funny because the more and more we did it, like he would just want to like grab the bottle of Copaiba and like want to gnaw on the bottle, which is like so crazy. Um, but yeah, it's very, very safe, very gentle. So Ray is just saying we love our On Guard toothpaste so much. Last weekend, my niece was here and she stole mine. I've had that happen too, Ray. So good. It's been I've been using both flavors, switched it up when one is used up. Yes, absolutely. I know I'm out of Supermint actually right now, Ray. Or John. I use Supermint in the morning, On Guard at night. Yep, and should we avoid fluoride at the dentist? Kehal, I get this question a lot, and this is what I say. I mean, it's up to you. There's so much information out there. There's positive, supportive information, and there's a lot of negative out there. So the thing about the fluoride at the dentist, I usually recommend it once a year. I do to all my patients if they are high risk. So like their brushing is not up to par, their flossing is a maybe. Um, my older patients that are suffering with dry mouth, yes, I do recommend it. We suck it up. So we'll paint it on your teeth and we'll suck it up with the suction. We'll have you close, open, close, open, close, open, close. So a lot of that is mixed in with your saliva will get sucked up. And the stickiness on your teeth is actually what we want. We want that stickiness to stay on your teeth for as long as possible. If you can hold off with eating, great. Drinking water is fine, but usually we tell you to like try not to drink anything hot. Of course, stay away from juice, sodas, things like that. Water is fine if you want to just sip water. We do want that. And if you're considered high risk, I would recommend it. So, like I was saying, not up to par hygiene at home. And then my older patients that have a decline in saliva and a lot of root exposure. So, for instance, my dad, he's 80 years old. His saliva has gone down significantly, not just because of age, but because of being on multiple medications. A big one is if you're on high blood pressure medication, 90% of the time you will have dry mouth. That is just a side effect. And so when we start to see that, and then all the gums have receded just because we're older and things recede, then their roots are not as strong as enamel, and you're more likely to get cavities on the roots. You can't repair a root with a filling, so I will say that. Um, and so if the decay is that like really bad, that's when the tooth has to come out. So just kind of looking at all those factors. So yeah, at least once a year. I know some dentists push it kind of twice a year, but if my patients are kind of on the edge, like, I'm like, just once a year. Just that's all I ask is once a year. I don't do fluoride drops with my kids. I will say that though. I don't feel like they need to ingest it. So topical use I'm okay with, but I don't do ingesting. Okay. So back to this On Guard paste, On Guard mouth rinse. We love this mouth rinse. Like we really, really love it a lot. Um, Especially when you're sick. I wanted to include that. You can just have a little shot glass of On Guard mouth rinse and soak your toothbrush in there just for a couple hours. It doesn't need to be like, I mean, you can do overnight too. That's fine. But you do want to let it sit out and dry. You want the air to dry out your toothbrush. If I've seen this before, they'll brush your teeth, spit out, and then they'll cover their toothbrush because they want to keep like bugs and things away from it. But if it doesn't have the ability to dry and it stays moist like that, it's going to, again, bacteria is going to have a party and it's going to multiply. You really don't want that. You want it to be able to dry. I didn't include this, but if you have like a partial denture or a family member does, a removable type of appliance, a retainer, things like that, On Guard mouthwash is perfect for it to soak in. Um, I wouldn't add additional oils, such as like adding more drops of On Guard, especially if it's a retainer or a partial. It can actually eat away at the appliance. It's a little bit too strong, our essential oils. But just the mouthwash alone is fine. I soak my retainer in there. So it's absolutely fine if that's something you are thinking of. Again, no fluoride in the mouth rinse, same like the toothpaste, no fluoride, but still has the benefits of protecting the teeth and the your enamel. Okay, if you want to make your own, I just wanted to include this because before we had On Guard mouthwash, we had to become creative. And this was one of the things that I would use, but I would also add a few drops of On Guard, but peppermint, tea tree, rinse out really good and just spit it out. I mean, even if you didn't want to include tea tree, you can actually swallow, right? On Guard and peppermint if you wanted to, but totally up to you. But this is just another idea I wanted to include. Okay, let's read the chat. All right. Oh, the mouth rinse, yes. Okay, John just said, Kanani recommended to me to gargle and swish a copaiba, tea tree, and frank with a mouthwash for me to keep my tooth gum situation at bay. Oh, good. I'm so happy, Ray. Yeah, we had a long talk one morning about that. Happy it is helping you. All right, so flossing. So everyone, not everyone, that's not good. A lot of people I talk to don't like to floss. They're like, why do we have to floss? I use an electric toothbrush. Like I do this, I do that. And I'm like, okay, guys, but we gotta floss. Like nothing can get in between those spaces. We have to floss. You remember? We're disrupting the colonies of bacteria. That's what we do. It's actual like the mechanics that's gonna disrupt those colonies. So this is our demonstration right now. So if you have your floss and your myrrh, take a piece of floss, like yay length. I go like right past my elbow. Like if your arm's out, okay? If you want to, join in. If not, just watch and try it later. I kind of roll it up into like a little ball. You guys see that? Take your myrrh. This is amazing. Liza, you're going to become a flosser. Okay, take your myrrh. You guys can't see that because I have my blur on. But you just do like a couple drops and it's a resin, so it's pretty thick. And take your myrrh, right? There's myrrh. Whoops. Floss and rub it into your myrrh. Rub it in. All you need is like 1 to 2 drops. You don't need a lot. Then I'm going to teach you guys how to floss properly because a lot of patients are like, I didn't learn how to floss before. So don't use your pointers. Don't use everybody uses their pointers. I see John's face right now. We're going to use tall man. Use your tall man. Your index finger, your pointer, and your thumb is your guide to rub the sides of the teeth. You're wrapping with your middle finger. Okay, we're just gonna do front teeth. You're gonna put it in, pour a chi, and each side of the tooth. You're gonna hug the tooth. You're getting myrrh into your gums and disrupting those colonies. Uh-huh. It tastes good. It doesn't taste bad, right, John? Okay, you're really rubbing the sides of your teeth. You're not being crazy, but you're not being gentle. I will say that. Like you really gotta get in there. Okay. So I'm gonna have to throw that away in a little bit. But I want you guys to do it. It feels so good. Myrrh is so soothing and great for the soft tissue in the mouth. It's amazing. So to me, it's like, no wonder you're going to partner. Like, it makes sense. You're going to partner frankincense and myrrh to support the area that has the most bacteria dirtiness is your mouth, right? We're going to calm everything down with, there's other oils, but I just love how good that myrrh feels on the gums. The more you do it, I've been doing it now. I read about this and I just kind of forgot. So I've been doing it now for a couple weeks. It feels so, so good. If you have an inflamed area, get into that area with floss or those little soft picks that you can kind of massage. I don't have a picture of that. I wish I did. Here's another idea to support your mouth. This is a water pick. A water flosser is just as great. The beautiful part is in that well of water, you can add your essential oils. If you want to add, On Guard is great. It is a little spicy, but it's great. You can add your myrrh, you can add your frankincense. What I will suggest is that if you decide to do that, run another cycle through with just water so the oils aren't just sitting in there because our oils are very strong, right? It can kind of eat away at that plastic. So you want to just run an extra cycle through. But what I have been loving is just putting On Guard mouthwash in there. Just some water and On Guard mouthwash. And you don't need to fill the entire well. Just what you need for your mouth. That's kind of a lot of water. I don't know if she's going like 3 times around her mouth, maybe, but you don't need to fill the entire well. So yeah, On Guard mouthwash is great. All right, essential oil is great for gum support. So we talked about tea tree. Copaiba is amazing for pain. So that's why I said we used a lot of it during teething. Colton used a lot of it with his wisdom teeth extractions. Copaiba is really, really good. Frankincense, we talked about, great for inflammation, along with myrrh. Great on the gums, supporting the mucosa in the mouth, cold sore, canker sore, anything like that. Clove is also really good. Like if a child has a tooth erupting and the gum gets really puffy, it starts to look like just red and like, because the tooth is trying to poke through. But just be careful because cloven on guard is a hot oil, but it does provide numbing. So that's really really nice. I've used it before where something just doesn't feel right, and you just dab it like a drop in the area, and it just goes numb. So those are kind of what I would recommend. So teething baby, this is what we did. Halitosis. So it's tricky because I've had patients come in and I work at periodontal office. So by the time you get sent to us, you usually have a significant issue with a gum or something's going on with your gums. So, but one of my patients was like, I don't know. My wife just told me my breath is stink. I don't know what's going on. And he's like, can you smell my breath? I'm like, well, I'm double masked. I have a shield. Like, not really. And so, it can be due to more than just like maybe you're not brushing well or flossing well. Like it can be due to like acid reflux, go or acid reflux, GERD, things like that. So you would want to talk to your doctor about that. But taking care of the tongue, like we don't remember to use a tongue scraper often or even brushing your tongue. That's really important that we need to remember to clean our tongue because that takes in so much when we eat and drink, right? But simple things, peppermint beadlets. It's always great to have those in your purse, in your car. Pop a few beadlets. It will calm down whatever um, acidity that's going on in the stomach as well. So that's awesome. And then I can't stress enough. It is if it is a stomach thing, you got to get on PB Restore. You got to be able to support your gut because that is hand in hand. If you're starting to see things show up in the mouth, um, uptake and decay, things like that, it might be going something going on in your stomach that's contributing to all of that. So paying attention to, I didn't include a slide to this, but this was another encounter I had yesterday with a patient, paying attention to what we're consuming. So I had a patient that was giving her kids kombucha every day. That's a little too much acid. It's great for supporting the gut, but all of that acidity on the teeth, not good. So this child was really having a hard time and needed a lot of dental work. So thinking about what we're consuming daily, um, and if we're allowing all that acid to sit in our mouth and on our teeth. All right, I think I have one more slide. Yep, it is just a reminder we are in BOGO week. Things are selling out quick. So make sure you're, supporting your people, you're sharing, you're talking about it. I actually took a picture of what is almost sold out. I didn't include it. I didn't have time, but Cheer and Passion is almost sold out. It's 75% sold out, along with the BOGO bundle. Copaiba and Lavender is 50% sold out, along with the Roman chamomile that you get for free with the 150 PV promo. So that is the latest update that I have. That was this morning, right before I went to work. But yeah, I would just say like really get on it. It's so good. I love it all. I love all. These bogos are. I really like these bogos. It's really what I use. Not so much passion and cheer, but I love to diffuse it. But everything else I use all the time. So I'm going to just read the chat again, see if there's any questions. Oh, you're so funny. Oh, you've been doing the flossing wrong. I know. A lot of my patients floss wrong. Auntie, you're so funny. Liza's scarred from you flossing her.
Oh my
And
God.
I don't,
It was scarring. Like she'd sit us on a stair and have our head back and she would freaking go to town. I hate
okay.
floss.
She's traumatized. I get it. I have those kids too that come in my chair. Okay.
What's funny is I never actually had a cavity in my adult teeth until I was like maybe 40, 42.
Wow.
I never had any cavities in my teeth until I was about 41, 42. Yeah.
That's awesome.
Yeah.
That is so good. My first cavity was in hygiene school. Can you even believe that? I'm learning about the mouth and I'm getting cavities at the same time. Go figure.
Some of
Um,
it is hereditary though, yeah.
Yes and no. I mean, yes, a part of it is, but if you're diligent,
Yeah,
yeah, if
you
you're
should be
diligent.
fine.
And I wasn't. I mean, in hygiene school, you eat when you can, you're a total crazy snacker, coffee all day long. Like, it's the worst diet. Like, I'm like, no wonder you got cavities. You ate crap food all day long and just coffee, coffee, coffee. So, um, yes, Nick, thank you. That is a very good tip because that's how my cover doesn't get stuck. I add fractionated coconut oil to the rim, and then that way it doesn't get stuck on there. So thank you so much. Yep, because myrrh is thick. You can use a drop or two. That's really nice to just do like a drop with your floss and rub it in. Um, okay. Any other questions, guys? Let me stop my share. Anything else? You guys good? Anything I didn't cover that you guys want to know about the mouth? I mean, I don't know everything, but I can at least share what I know. So, well, call me if you guys have anything that comes up.
That was awesome, Kanan. Thank you.
Thank
Kanani,
you.
Kanani, I just want to say this is Sherlyn. I just want to say I just tried with the myrrh and I put some frankincense in there too. Oh my gosh, it is so good.
It
Just like
is.
I'm gonna do this from now on.
Yep.
Sorry, Liza. I didn't mean to scar you.
Yeah, try it, guys. Do it for like a at least a week. It honestly feels so good. Your teeth feel extra clean for whatever. Well, I know why, but it's like the mechanics and of like driving those oils into the gums. Okay, thanks for jumping on. I know it's a small group, but thanks you guys and happy BOGOs.
All right. Wait, do we have
Oh,
no call next week, right? Is it
because
next
it
week?
is
Because
very
of sort of 4th of July-ish. Let me look at the calendar.
we said no call. I thought we said the ninth.
Oh yeah, the 9th. Okay, so next week is gonna be teens and college with Jai, and then the 9th, no team call. Okay,
Yeah.
perfect. Thanks, Kanan.
Thanks, guys. Have a good night.
Bye. Good
Bye.
night.